In this video, we're going to discuss about marathon training with an Achilles pain. It may be that you've been training through pain for a long period of time with a goal at the end that you're working towards, whether you've raised money for certain charities, it's your first marathon, or you're going for a personal best. It might be that you're very close to the marathon and suddenly this pain has come on, either during a long run, or maybe you've changed your shoes, or something's happened and you're starting to feel it and you've only got a few days to weeks to go. In this video, we're going to discuss, can we continue to train? Do we need to modify it and what can we do? Is it dangerous if I still continue to train? And what should I do about it? I'm Ali. I'm one of the physios from treatmyachilles.com. We're an online physiotherapy service treating all things Achilles based. So if you'd like to find out a little bit more about our service or book an appointment, please have a look in the information below. So how does running affect our Achilles tendon? How does that work when we're running? Well, our Achilles tendon is the tendon that attaches to our calf muscles. Our calf muscles, we have two in particular, the gastrocnemius and soleus, that run down the back and turn into the Achilles tendon that then attaches into the bone. This job, when we're running, is when we plant our foot, it recoils like a spring, and then as we push off, it releases that energy and we start to push forward and move. So if you're looking at a marathon training, how many times do we need to do that movement while we're running? Well, it depends on how fast or how long your stride is, and it can be anywhere from 25,000 to 50,000 steps. Now, that's quite a lot of load, and anyone training for a marathon can tell you that the whole body's taking that load. It's also not just that push-off movement. It's taking a ground reaction force, which can be up to 6 to 12 times your body weight on each step. So that would indicate that your Achilles needs to be, or calf muscles and Achilles need to be quite strong and robust to be able to cope with that. It's a lot of cumulative load because it isn't just a one-off event. There's all of that training beforehand. So if you think about that, if you were to just stand still in your house and start to do between 12,000 or 25,000 calf raises in a row, how would your Achilles and your calf cope with that? That's the sort of load a marathon is going for. Now, people can train with that load and they can do marathons and they can do them fantastically and never have any Achilles problems. But if the Achilles starts to be a little bit uncomfortable, lots of runners ask themselves these sorts of questions and then they come to us with those questions. Was it my shoes? Is it my running style? Have I done something wrong? What's my training like? Should I continue? Do I need to stop? Is it going to tear or rupture? What shall we do? And this is where our team at Treat My Achilles is really experienced in dealing with runners. And we're looking at your training load, whether there's been sudden increases in anything, including sprint intervals or hill reps or different terrains you might be running on. What's your recovery like? Quite commonly, we talk to people and they're running 6 to 7 times a week plus normal day-to-day activity and work, plus any other sports and activities or looking after and playing with young children. We try and look for that whole pattern. So our body's tissues, including what makes up our tendon, which is collagen fibres, are constantly going through a cycle of repair and disrepair. It's how our body adapts to load. So when we exercise, what you'll see is we start to do some sort of activity. Our body then adapts to that activity, which is that cycle of repairing and disrepairing and laying down new growth and new tissue. That needs a bit of recovery time and rest from that activity for that cycle to complete. If we were to not have rest and recovery and that cycle overlaps each other on repeat, that's when we enter what's called a cycle of disrepair. It can't catch up with itself, and that's where we're more likely to get overuse injuries, one of which, and particularly in this example, would be related to our collagen and our collagen cycle of this repair and disrepair, because that's relevant to tendons and Achilles tendons. We also want to assess how strong that calf and Achilles complex is. So we look at your capacity for that tendon and that calf muscle to perform certain tests, such as calf raises, which you may well have seen or read about. We're looking at Achilles and calf strength exercises, or indeed hopping and jumping changes. We're looking at what your past injury history is. Is there anything else going on in your body from up the top all the way through, or past injuries that you've had? And we're looking at your general health. Have you suddenly started taking medications, or is there something that might be causing this that isn't just what we've just been talking about? One of the questions that's the most common is it my running style that can cause this? Is it a difference if I'm a midfoot, a forefoot, or a heel striker when I am running? And actually, the research is showing that there isn't a correlation between more people with this sort of landing pattern get Achilles tendinopathy versus not doing that landing pattern and getting Achilles tendinopathy. Actually, it's a much bigger picture than that. So suddenly changing your running style is probably not a quick fix here. Actually, if you were changing it and suddenly gone from being one particular way to the other, for example, or vice versa, you might then find that you're actually starting to develop Achilles tendinopathy pain because of that reason, because you haven't trained in that new way of loading that calf or Achilles. So the bigger picture here is not necessarily changing that running style, although how you're moving and what's going on with the rest of your body and how you're strong in all sorts of different areas, whether there's any other previous injuries, is important. But that sort of heel strike, midfoot or forefoot strike isn't something that needs suddenly fixing because you've got an Achilles problem. Actually, it's more looking at what is the capacity of your tendon to cope with the demands that you're after, which includes the strength. It includes how much load you're putting through it. And by load, I mean activity. So time on feet, other responsibilities, training, and any exercises you're doing for this issue, on top of everything cumulatively added together, and what rest and recovery you're getting. Sometimes we get people telling us they've had scans and they're concerned by their scans. It looks abnormal. So, abnormal changes on a scan, what we're looking at with tendons is that we should be able to see collagen fibers in nice, neat bundles, all looking very uniform. In an area that's affected, those areas of collagen fibers are no longer looking uniform. They're looking a little bit more spread out or not so organized. And we might have an increase of water content or irritant in between. And in some circumstances, we might get new blood flow or nerve endings going into that area. They're all signs of tendinopathy changes. But what we have to do is look at the bigger picture here. So scans show structural change. And in a large population, even with people that have never had Achilles problems, there can be some of these structural changes there. So it must correlate to the signs and symptoms that you have alongside what we've spoken about before, that strength, that capacity, that function, how you're using it. Can you tolerate that load? Can you progress your running? Can you progress any strength training? And if that answer is yes, that's all comfortable, yet I've still got something on my scan, the scan's not showing pain or symptoms, we don't really need to worry if we have checked those other things out and we can continue to do our exercise. There's normally a few different types to stages to an Achilles tendinopathy. There's that real acute, oh my gosh, it's really irritated, it's maybe a bit thicker, it's really tender, it's sore, it's just started to be painful. Or it's been grumbling along for a few weeks to months, I can manage it and I can keep going kind of level of Achilles tendinopathy, or there is the chronic, it's been here for a very long time. I'm not really sure how, if I've been able to keep training. Sometimes it's okay, sometimes it isn't, but it's been going on for a significant period of months or years now. So if we're looking at that demand on our body with those tendons, That answer about should I continue to keep running and train for my marathon will completely vary. It will vary already on what we've just said about what stage your tendon might be in. It might vary on your step or your load, and it might vary about how strong and able and robust your Achilles is to cope with the demand, as well as the rest of your body and also your health or any other medications and things we might need to consider. So we're going to talk through two case examples, both 3 weeks out from a marathon, both having trained well, but both dealing with Achilles problems. One very successfully managed to complete the marathon and actually get a personal best, and the other unfortunately had to pull out, even though they chose to try the event because they'd raised a lot of money for charity and they were close to that event by the time the Achilles was bothering them so much. So if we look at the success story, so this person's pain was not their day to day. They could walk and move around their home. They could do all of the jobs and activities they wanted to do without any symptoms. There wasn't really any symptoms whatsoever in the morning. When they went for their longer runs, as they were running towards the end of that run, that pain might begin, and it was around a 0 to 2 to 3 out of a pain scale of up to 10. So that's what we would say is a tolerable level or a niggle level of pain, which you can see some videos about that we've had in the past. We also know that on their testing, the day after and over that 24-hour period after that longer run, that pain would resolve and go away. They were able to do their calf raises and not have any pain when they were doing that, and they were able to hop and not have any pain. They used the 2 weeks before that marathon to taper, which was telling them that their Achilles was just about coping with that level of activity, and then it needed just that rest and recovery time to be ready to then go and run that race. And off they went, ran that race successfully, and they got a personal best. In the second situation, which wasn't very successful for them to finish that marathon, again 3 weeks out, but this time the pain was behaving in a different way. It was uncomfortable, but normally for the first 30 minutes of the day, it was stiff and it was making them feel like they had to hobble until it warmed up. Then it warmed up and felt okay again. They started to run, and when they were starting to run, there was pain. It then warmed up, and then they got pain again towards the end of that run. And over the last few weeks, their history was that that pain was coming on quicker and quicker into that run. They had to run less before that pain returned and came back. They weren't able to do a calf raise at home or any of their exercises without pain, and they also were unable to hop with pain. So with that 3-week window leading up to the marathon, their tendon was too uncomfortable and not coping with the capacity and demand that it was asking to have that period of time to recover, ready to run. And so unfortunately, they had to pull out on that day. So in essence, no one is the same. No one has got the same blanket answer. You can't suddenly search and get a recipe for how to do this and how to marathon train with it. Because two runners, for example, can both say, my Achilles hurts, but it may be very completely different situations. So if you are close to that marathon and you're not sure, again, reach out to a clinician and see what they can assess for you. But really, at this stage, you're thinking, well, my fitness is already built. I have trained to this level. One more run's not going to suddenly increase my function or my fitness. So the main focus at that time is, can I calm it right down? Can I decrease those flare-ups? Can I protect the work that I've done already? So the opposite to testing it completely. Is it still sore if I squeeze it? Is it still sore if I hop on it? Is it still sore if I run or if I were to do my exercises? Oh, quick, there's some pain here. I need to fix it. I'll quickly have a look what exercises there are to do for Achilles. I'll start doing these loading exercises and I'm adding more strengthening things in. Actually, that's adding to the load and it's not helping it settle and calm down. And the idea that the taper is not a wasted period of time, it is recovery time when we're thinking about what we spoke about, that irritant building up in between the fibers, that cycle of repair and disrepair. But again, these examples and this advice is based on people very close to a marathon. What we really ideally want to look at is how the people before they're at this point prepare? How are they going to set up that program? Has their Achilles started to grumble? What can we do to build up strength whilst they're continuing to run? Or afterwards, I've recovered and I'm ready to start doing a rehab program. How can I gradually progress that capacity, that strength and ability that I've got in my Achilles? So, how do you know whether you can completely keep running? Well, that just depends on what we've said before in those case studies, that type of pain and when you're getting it. So, you want to be asking yourself, how does it feel when I'm running? How does it feel the rest of that day? The beginning of the next day? Pain and stiffness is a story from the following day and the following morning about what you did the day before. So, it's important to correlate the two together. Whether that general trend over the last few weeks is staying the same or improving. Again, all of those signs, if they're coping, it's minimal, you're able to manage and it's not there the next day, the general trend is it's not worsening, you're probably all right. Again, worth getting it checked out in a case-by-case basis, but probably a good sign with those. If that isn't the answer, we need to adjust something, and it's not just total rest. It's how do we play with those factors and see. In some cases, it might be resting from running and cross-training for a period of time. Again, that depends on the case-by-case basis. What's one of the worst things I could do? Well, it's really twofold with that then. One, just ignore it. It'll get better, all right. It warms up and then it goes off and it doesn't really bother me, but it's grumbling around. If you just keep ignoring it, again, we notice maybe that tolerance level, that capacity for coping might decrease over a period of time, or your pain increases as well as that. Secondly, okay, I'll just stop completely. I won't do anything at all. I'm going to just stop, and then it'll feel better because I'm not running it on it anymore. Like I'm not pressing on the bruise anymore. Feels more comfortable. I'll go back out again. Actually, it's that middle ground. It's finding what is the appropriate load my Achilles can cope with at this moment in time for running and for rehab. And that's where we can help you, but clinicians that are specialists in this area can help you too. So a few other questions that we get that are relevant to this would be, my Achilles has just started hurting because I've changed my running trainers. Is this a problem? Well, actually, it's a sign of an irritant. It's irritated it. And what's probably irritated it is because that loading is different in your new trainers compared to your old ones. So a common mistake is, okay, it's hurting. I need to just quickly, again, start strengthening, putting all of these activities. Actually, you're then adding load to a new load from your new trainers. So what it's telling you is, if you're used to it being quite calm before you put your new trainers on and suddenly this has then changed your symptoms, is we might need a deload time. We might need to calm it down before we start to build it back up again. So all is not lost if this has happened, but it's something to consider not doing right towards the end of your marathon training. Some other questions we have based on this topic is if the Achilles feels tight, or also if it feels tender and sore if you press on it. Well, tight can mean lots of different things. If it's muscular tightness and stiffness because you've used muscles you haven't used for a while, or they're recovering from doing a large amount of activity, that's very different to a tendon being irritated and sore and causing stiffness. If that's the case, the stretching for the tight muscles and loosening off the tight muscles and that delayed onset muscle soreness from exercise, great. Stiffness and tightness within the Achilles itself tend to be signs of an Achilles tendinopathy, and aggressive stretching may not be helpful and sometimes can actually be irritable in this case, especially if it's more down the bottom around that insertion where it attaches into the heel. We have lots of articles about stretching and an insertional Achilles tendon. Both stretching can also be irritated by mid-portion, so it's worth again getting some advice, but please have a look at those links below. If it's tender where you're pressing, but you're not really getting any other symptoms at all, or it's that tenderness is remaining, but yet things are improving, that tenderness is not necessarily a good sign of how things are getting better or not getting better. It's just telling us that you probably have an Achilles tendinopathy or tendonitis. So it's more about those symptoms, that 24-hour pattern, your ability, and what you can manage with that next day response and also progression over time that we're more interested in as to tell us whether there's a problem or not, or whether that problem is improving. And therefore leads us on to our final question, which is one of the ones that most people are concerned about. Is it likely to rupture? Is it likely to tear? So the good news with running is that it's less likely to rupture or tear than other more explosive ballistic sports. So that tends to happen with a sudden excessive force moving forwards or a massive stretch. These sorts of sports are like your basketballs or tennis or football, something where you're suddenly going into a sprint or a stretch type movement. This is less the case in running. One of the research papers grouped together hiking, stretching, and running together versus these explosive sports, and the incidence was about 6% in our hiking, stretching, and running group compared to 43% likelihood or incidence, sports related incidence of Achilles rupture. But there are a few things with caveats with that. It's very difficult to predict, and we need to look at you as a whole. So, for example, sometimes ruptures do happen, and they might be that we haven't got a clue, we haven't had pain or symptoms in our calf or Achilles at all, and ever before. If you've had a large amount of symptoms over a long period of years and time, and we're looking more at a degenerate tendon that's really lost its capacity for strength, we're more likely to have a rupture there than if you had one that had been progressed and strengthened or one that's just started. So again, there isn't a definite that this will happen or not happen. It's just really quite unlikely with running. If you are feeling like you've had this pain for a chronic period of time, then again, it's worth getting the proper advice and right advice about where you are and what you want to do. There are a few things that can increase the rupture risk as well. If you've taken some sort of antibiotics from a particular family called fluoroquinolones, if you're not sure, read your side effect leaflet. It will state in there that there is a risk with this, and then it is worth discussing with the person that gave you that medication for what reason they gave it for you. Usually gave it to you for, about what you can do about those things, and gaining advice then on how to progress training and moving forward. And you're also more likely to get it if you've had a steroid, a corticosteroid injection into the tendon, which is why that's rarely used now. So again, please be reassured, it's unlikely. It is 6% sport-related ruptures happen within the running, hiking and stretching group compared to the more explosive sports. Therefore, in summary, what you do before the marathon to build up with your training, your rest and recovery, and your load and capacity management of your Achilles can help the outcome during the marathon. What you do after the marathon to recover, but also if you have had any Achilles symptoms that's helped you get through that marathon, now's the time to address it properly. If you would like any further advice on what to do about this, again, please have the look in the links below for further information or how to book an appointment. Thank you.